Welcome to the Hospital Finance Podcast, your go-to source for information and insights that can help you protect and enhance revenue at your hospital. And now, the host of the Hospital Finance Podcast, Michael Passanante.
Hi, this is Mike Passanante, and welcome back to the Hospital Finance Podcast. Today we're joined by Miranda, who is the director of our Reimbursement Services team here at BESLER Consulting. Maria is going to be talking with us about quality measures as they relate to the Comprehensive Care for Joint Replacement program. So welcome back, Maria.
Thank you, Mike.
So Maria, quickly for our listeners, could you just give us a recap of what Cjr is?
Sure. So Cjr is the new mandatory bundled payment model introduced by CMS that became effective for almost 800 hospitals in about 67 MSAs on April 1st of this year, just a few weeks ago. The Comprehensive Care for Joint Replacement model, or Cjr as we call it, aims to support better and more efficient care for beneficiaries undergoing the most common inpatient surgeries for Medicare beneficiaries, which is hip and knee replacements. They're also referred to as lower extremity joint replacements, or LEJR. So hip and knee replacements are the most common inpatient surgery and can require lengthy recovery and rehabilitation periods. In 2014, there were more than 400,000 procedures, costing more than $7 billion for the hospitalization alone. It's no wonder that CMS has chosen these procedures for this new program. This alternative model will contribute to Medicare's goal set by the administration of having 30% of all fee-for-service payments made via alternative payment models by 2016 and 50% by 2018. Quality health care is a high priority for the Department of Health and Human Services and the Centers for Medicare and Medicaid Services. CMS implements quality initiatives to assure quality health care for beneficiaries through their quality performance measures.
Thanks for that, Maria. So let's dive into the quality measures as part of this program, and we've broken various pieces of this down through a series of podcasts. So today, can you just explain for us what a quality measure is as it relates to Cjr and why it's important?
Sure. So quality measures aren't new to hospitals and certainly not to CMS. Over the past several years, Medicare payment policy has moved away from fee-for-service payments that are not currently linked to quality, and they're moving towards payments that are linked to quality. So in the final rule for Cjr, CMS presented their belief that Cjr would test an episode payment model with the goals of improved quality of care and cost efficiency. Incentivizing high-value care through episode-based payments for lower extremity joint replacements is a primary objective of Cjr. Therefore, incorporating those quality performance measures into the episode payment is essential. It's an essential component of Cjr. CMS believes that quality measures integrated into the Cjr model will allow for an effective assessment of post-operative outcomes. This quality-specific detail will also provide an opportunity for CMS to collect data from the patient's perspective, data that are necessary to finalize and test specifications of a hospital-level, risk-adjusted, patient-reported outcome measure. It's called the PRO, for primary elective extremity joint replacement procedures.
So clearly, quality measures are important as they relate to Cjr. So let's unpack this a little bit. Can you explain to us which quality measures are being used in the new model and how they're being used to determine quality?
Okay. So in the final rule for Cjr, CMS adopted two quality measures, as well as a voluntary reporting for patient-reported outcome, which is the PRO data, that will be used in a composite quality score methodology to link the quality total hip and total knee surgeries in participant hospitals to determine the payment. The first measure is called an RSCR, or the hospital-level risk standardized complication rate, following elective primary total hip arthroplasty and or total knee arthroplasty. This complications measure is currently implemented in the Hospital Inpatient Quality Reporting Program and the Hospital Value-Based Purchasing Program, and assesses a hospital's risk standardized complication rate, which is the rate of complications occurring after primary elective total hip or total knee surgery. This measure outcome is the rate of complications during a 90-day period that begins with the date of the index admission to a specific hospital. An index admission is the hospitalization to which the complications outcome is attributed. The second measure is what's known as the HCAHPS, or the Hospital Consumer Assessment of Healthcare Providers and Systems Survey Measure. The CJR model will use HCAHPS survey measure, which is a national standardized publicly reported survey of patients' experience of hospital care. The HCAHPS survey measure is a survey instrument and data collection methodology for measuring patients' perceptions of their hospital experience. The HCAHPS measure asks recently discharged adult patients 32 questions about aspects of their hospital experience that they are uniquely suited to address. The core of the survey contains 21 items that basically ask how often or whether patients experienced a critical aspect of hospital care.
Maria, how are these quality measures used to determine payment to providers?
So CMS has adopted a composite quality measure that will be used to determine eligibility for reconciliation payments and to reward hospitals for quality performance. The quality measures will be used to compute a composite quality score. The composite quality score computed for each participant hospital will summarize the hospital's level of quality performance and improvement on specified quality measures. The CJR model assigns different weights to each of these measures. The measure weights for the composite quality score are 50% for the hospital level risk standardized complication rate following elective primary hip or knee surgery, 40% for the HCAHPS survey measure, and 10% for the voluntary patient reported outcomes data submission. So in other words, these quality measures will actually determine whether or not the hospital gets a payment to begin with.
Maria, how are the composite score quality performance points calculated?
To calculate quality performance points, CMS will first capture each participant hospital's measured performance on the total hip or total knee complications measure, which is captured in the Hospital Inpatient Quality Reporting Program. Next, CMS will capture the hospital's performance measure on the HCAHPS survey based on the 4 most recent quarters in the HIQR program. Then the national data for each measure for all hospitals in the Hospital Inpatient Quality Reporting Program with reported quality will be arrayed to determine and assign a percentile distribution for the scores for each participant facility's quality measure components. Then the hospital quality performance score on each measure will be compared to the national percentile distribution. Finally, the hospital will be assigned quality performance points based on where they fall on the scale of CMS-defined performance percentiles. The hospital will receive a quality performance score for each of the measures. Once all of the achievement and improvement points are calculated for each measure, including the points awarded for the reporting of the total hip or total knee PROs and limited risk variable data, all of the points will be added up to calculate the participant hospital's composite quality score.
Okay, so how is the composite quality score used to determine payment?
The composite quality score will be incorporated into the pay for performance methodology for the CJR model that assigns a participant hospital to a quality category at the time of reconciliation for a performance year. Hospitals that provide high-quality episode care will have the opportunity to receive quality incentive payments. based on their composite quality score that places each hospital into one of 4 quality categories. Those categories are below acceptable, acceptable, good, and excellent. Annually, a hospital will get a series of points that convert into a composite quality score. So essentially, that means that if you have less than 4 points, you will be assigned a quality score of below acceptable, and you won't be entitled to any gain sharing. Furthermore, your target price will be set at a 3% discount from prior year's charges. That's a pretty significant impact on reimbursement, considering that it represents 3% reduction from the total bundled charges, which includes professional fees, post-acute care, readmissions, and hospital charges. On average, that represents about $1,000 per case, which is a penalty to the hospital. Now, hospitals receiving between 4 to 6 quality points will be assigned a quality score of acceptable. I'm not sure how acceptable a 2 to 3% discount on target price will be, since that equals an average penalty of about $600 to $1,000 per case, which is payable back to CMS at the end of the year. Hospitals scoring between 6 and 13.2 points are scored as good and will only get a 2% reduction on the target price. And finally, hospitals scoring above 13.2 points are considered excellent. Their discount will be 1.5%. This is still a modest impact, but it's only half of the highest possible discount of 3%. A hospital in this scenario is in a much better position to be successful under CJR.
Will this quality measure data be available to participating providers?
So in order to facilitate access to the measures data included in the CJR model, CMS will post the data on each participant hospital's performance on each of the finalized quality measures in a downloadable format in a section of the Hospital Compare website specific to the CJR model. Similar to what is done today for the Hospital Readmissions Reduction Program and the Hospital Acquired Conditions Reduction Program. CMS will post the absolute score on the measure as well as the percentile score that is used to tie quality measure scores to payment. The CJR specific data will be posted on the same time frame as the existing Hospital Inpatient Quality Reporting Program for July public reporting on the Hospital Compare website. The voluntary total knee and total hip patient reported outcomes and limited risk variable data will not be publicly reported. However, CMS will publicly acknowledge that a hospital has participated in the data submission by placing a symbol by the hospital's name when posting the total hip and total knee complications measure and the HCAP survey measure results on the Hospital Compare website.
Maria, last question. What can providers do to get started on the road to gain sharing with CJR?
So voluntary submission of the total hip and total knee patient reported outcomes measure is the easiest thing that hospitals can do to get started on the road to gain sharing. Submission of PROs offers a 2-point bonus on quality scores and is the first step towards measuring and improving outcomes. Careful study of PRO data will provide insights into what's working and what isn't and offers a competitive advantage for hospitals. Hospitals would need to report 50% of their patients' PRO data or at least 50 patients to earn 2 additional bonus points to the composite quality score. So right now this is a voluntary submission, but 2 points is pretty significant, and it's the easiest thing you can do. And we know that in the end, when CMS collects this data, they always go back and utilize it for other measures. So it's an easy thing to do, and it's 2 bonus points. So I think that's the first place to start.
Maria, thanks for helping us understand more about CJR quality measures.
Great. Thank you, Mike.
For more information about CJR, get our new special report at BESLER.com/CJR. This new report discusses how CJR works, describes the responsibilities of anchor hospitals, affiliation agreements, NPRA, and the corrections and appeals process. Again, that's BESLER.com/CJR. If you enjoy the Hospital Finance Podcast, please head up to iTunes to subscribe and leave us a positive review.
This concludes today's episode of the Hospital Finance Podcast. For show notes and additional resources to help you protect and enhance revenue at your hospital, visit BESLER.com/podcasts. The Hospital Finance Podcast is a production of BESLER Consulting.